It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. And today, our topic is Medicare and does it pay for ambulance services? And joining me is Lance Jarvis, Brevard County SHINE Area Counselor. Welcome, Lance.
Thank you. Nice to be here again, Joe.
Well, it's always a pleasure to have you on the show, and you're on our advocacy group. You advocate for elders. You have been serving the elders of Brevard County as a SHINE counselor for how many years now?
7.
7 years. But in 1996, when United Way did a survey of the county, we did a needs assessment. Mm-hmm. Where were you working then?
I was with the University of Central Florida.
What did you do there?
I was Director of Programs in Business Administration for Brevard County.
For Brevard County?
Yeah.
And that's how you got hooked into doing the survey?
Yes.
Or the assessment?
Well, yeah, and I had already been involved with United Way as Chairman of Community Services.
Okay, all right. It was interesting, folks, because when I got Lance involved with our Senior Advocacy Council, and I brought this needs assessment document to our meeting, I didn't realize that Lance pointed to a little place where he signed his name as the co-chairman or something of the needs assessment. So yeah. My point is that you have long been involved in Brevard County in serving senior citizens and elders.
That is true.
And it came to my attention, folks, several weeks ago, a question about ambulance services and what does Medicare really pay for, and what is our responsibility? And I think we need to know more about all this. So we asked Lance about it, and he sent me the questions to do a show on this. I think I added 1 or 2 to it. We have a total of 12 questions. And this is one I want to go by the book, and I want to follow this thing. And my first question was, how important is this topic, and how much is it needed for discussion, Lance?
I think it's very important that we understand, Joe, that ambulance services in Brevard County, like they are in most municipalities and counties throughout the country, are not free services. Yes, your taxes help to support fire and rescue and ambulance services, but ambulance services bill either your insurance or you, depending upon whether or not insurance pays. So this is a service that many people are under the misconception is that it's provided free. It is not free. Somebody has to pay. And so if this becomes important as a topic for discussion, particularly if you get a bill.
Right.
If you get a bill for an ambulance that you called, and those bills may run $600 to $1,000. So I think it's important that people understand when Medicare pays and when they don't pay for ambulance services. Well, ambulances are not a taxi.
Yeah. And not a what?
They are not a taxi.
Not a taxi. Oh, I understand that. I think what got my attention, Lance, was it was a case of where an individual wasn't feeling well, and his son was there, and they had called paramedics. The ambulance people came, and they asked him if he wanted them, the ambulance people, to take him to the emergency room, and he said, no, he'd just have his son drive him. And no, he thought about his son could have driven him. The ambulance people explained that. He said, "No, I'd rather have you take," because he was concerned something might happen. Well, for some reason, it wasn't documented, and the trip was billed to him because his son was there, and his son could have taken him, but he didn't. He went with the ambulance, and I don't know what the bill was, but it was a pretty chunky bill.
Yeah, they are chunky bills.
So I think this is why how are people generally informed about ambulance? We never talk about it.
We don't talk about it, and people become informed about ambulance services when they get a bill like your person you're talking about.
Yeah.
That's when they find out that ambulances are really, there are very strict rules that Medicare has about when they will pay for an ambulance and when they will not.
Can you explain those so our viewing audience thoroughly understands that, Lance?
Absolutely. Medicare will pay for ambulance services if you have a sudden medical emergency and your health is in serious danger. This is a situation where every second counts, and there is no other form of transportation that is appropriate to get you to the nearest medical facility. So in the case of your, I don't know whether it was a client or somebody you know, it doesn't matter. The person you were talking about, his health was not going to be jeopardized if his son took him or if he called a taxi,
right,
or some other means of transportation. And in that case, Medicare would say that is not a medically necessary use of expensive ambulance services. So I think it's very important that people understand that Medicare will pay, but the circumstances have to be appropriate for using an ambulance, such as if an individual is unconscious, or they're bleeding badly, or in shock, those are emergencies for which time is of the essence. And an ambulance is a perfectly appropriate means to get you to the closest appropriate medical facility.
Okay.
Another circumstance would be if you need skilled medical care en route to the hospital itself. So you might need oxygen, you might need other medications provided through injectables. Sometimes that's administered when there's a suspected heart attack. Well, they're those skilled medical services that are provided by the paramedics on the ambulance. That's entirely appropriate. That's entirely appropriate. But it is not appropriate under many of the circumstances such as you've described when people call for an ambulance, such as the following. We had a client who came to the office, the SHINE office. The situation was this. The client fell off a ladder, suspected that he had broken his arm. He was able to get up. He was in some pain, but the way his arm was moving led him to believe that it might be broken. He went into the house, called 911. An ambulance came, transported him to the nearest appropriate medical facility. And I need to clarify that in just a moment. Medicare denied the claim. He had other options. A neighbor could have taken him, a taxi could have taken him, or he might even have been able to drive his own car. And time was not of the essence.
Right.
His
He might have been hurting, but
he was hurting, but it wouldn't have been worse if he had waited for another form of transportation. So in that case, Medicare says, no, this was not a medically necessary use of emergency medical services, emergency ambulance services.
What happens, Lance, if somebody's at home and they have shortness of breath and they have anxiety and they just don't feel right? You start sweating, break out sweat. These are all symptoms or indications of a respiratory problem or a heart problem. And you call the ambulance and 911 comes and the person's feeling better. Do they charge them for that? Paramedics coming to a house where they end up not taking somebody to the hospital?
Yes.
They do?
They will bill the insurance company for the trip that they made.
So if you're on Social Security, then your Medicare will pay for it.
If Medicare deems that it was a medically necessary and reasonable use of ambulance services. So let me follow up on that. We've just talked about medically necessary.
Right.
Every minute counts. The situation gets worse by the second that you are not in an appropriate medical facility. That is medically necessary use of ambulance services. But the other word is reasonable. So if you're in our county and you live in Palm Bay, West Palm Bay, the ambulance shows up and you say, I think I'd really prefer to go to Holmes Regional Medical Center. Medicare will only pay to the nearest appropriate medical facility. There is a hospital in Palm Bay. If they deem that the hospital in Palm Bay would be able to provide the services you need, they will only pay to the nearest appropriate medical facility. And that is what is considered reasonable. So if you request that the ambulance take you to a facility that is other than the closest appropriate medical facility, be prepared to pay. That's your choice.
I've never had anything like that hit me because I'm a senior citizen. I'm retired military, so my TRICARE picks up all those additional costs, I guess. I never thought about it.
Well, but if you used an inappropriate, let's say you were the person who was living in Palm Bay. The Palm Bay Hospital was very close.
Yeah.
And you said, take me to Holmes. Medicare is not going to pay that claim in its entirety, and neither will TRICARE for life, because TRICARE will only pay for what Medicare approves, your share of what Medicare approves. If Medicare doesn't approve it all, TRICARE isn't going to pay all of the balance that would normally pay.
You learn something every day.
Yeah, it's complicated. It is complicated.
It is. Do you know what the average cost of ambulance services is? You've been around it, but I have no idea what it would cost.
The average that I've experienced from clients who have come in with a bill is between $600 and $800.
$600 and $800?
Mm-hmm. $600 to $800.
Holy mackerel!
So we're not talking about small change.
No, we're not. I'm thinking of. Since we've started helping seniors, we have found a large number of elderly single women in their late 80s, early 90s that are living on $600 to $900 a month Social Security because they didn't have a high Social Security. And I would say in the 90% of the time, most of these people are unremarried widows of Korean or World War II veterans, and they didn't know it, and they're eligible for VA aid and attendance, which gives them another $1,200 to $1,400 a month to live on. And once they find that out, they're getting help. But I can imagine those people that live alone have an anxiety attack, call for the ambulance, and they get there and they're fine, or they're much better when the paramedics get there, because it gives you a sense when a paramedic gets there and says you're not having a heart attack or you're not having this, you do feel better.
Sure.
I've been there, so I know how people can put themselves across the breaker. I just can't imagine. I can't imagine, because we've had so many problems here in the county about ambulance costs. Who's going to pay for it? It's not something that's not well known, because it is well known.
Well, not that long ago, the fire and rescue people, which run the ambulances, revealed that they had about $7 million in unpaid bills.
$7 million?
$7 million over I think it might have been a 2-year period. So this is serious money, and while the ambulance people will take you to the nearest appropriate medical facility, whether or not you have the means to pay, you just have to hope that you can, that your insurance will pay. And it's important to point out that I'm talking about Medicare, Joe, and Medicare has its own rules.
Yeah.
Medicare Advantage plans, the other way of getting Medicare, may have slightly different rules. Same basic benefits, but may have slightly different rules. And I think it's important for people who have a Medicare Advantage plan to open up the directory of services that are provided by the plan that everybody gets every year, and see under what conditions the plan will pay for ambulance service.
And a Medicare Advantage plan is specified what it'll pay for and what it won't pay for?
In broad terms, yes. In broad terms, yes.
Do you think many people know that or even look at it?
No, most people don't look at it. I know that because I get questions every week that if people had read the benefits booklet that they get,
yeah,
and then these can be pretty thick. They have to be pretty thick because they have to comply with a lot of government regulations concerning what must be disclosed to the insured. But many of the questions are ones which are right in the book. They're very obvious, but people don't read it.
Well, how do people that get in this category, how do they find out that they owe money? They get a bill from the county?
Here's the way, 2 ways you might find out that Medicare did not cover any or some of the ambulance bill. One is you get a bill from the ambulance company. That's one way. And they will say Medicare didn't cover this. The other way you find out, Joe, is as you know, Medicare sends you what is called a Medicare summary notice.
Yeah, all those services, yeah.
All the services you received, what they paid, what they didn't pay, and the reason they didn't pay.
So you got to look at all those things.
You have to look at, see if the claim was paid. If it wasn't paid, off to the right will be what are called remark codes. It might be the letter I, the letter N, the letter M. And you look at the bottom of that page and it will say, the ambulance company did not provide full enough information for us to make a decision, which means you need to follow up with the ambulance company.
I have to make an admission. I get those things and I look at them, but do you think there's anybody that keeps all that stuff that comes out? Between my wife and I, if I kept that stuff for a year, I'd have a stack of stuff.
Well, if Medicare has paid everything, and your secondary will then pay for the balance, once you look it over and you don't see any reason to suspect Medicare fraud, it's perfectly all right to destroy it. And you should shred it.
Oh, I shred it.
Because your Medicare identification number is on that exponential benefit, so it should be shredded.
My wife's at the point now where somebody, and I don't know how true it is, but we had somebody tell us that they took all the shredded stuff to the where they keep the animals.
Oh, the zoo?
No, not the zoo.
Oh, the Humane Society.
Humane Society, because they used it for cat litter. Did you ever hear that?
No, but it's a perfectly good use of cat litter if it's shredded.
Yeah.
And cross-cut.
It is. So
why not?
I told my wife, I said, you're not going to start collecting this stuff. I try my best to get all this stuff out of the house. And now if I start shredding this stuff for cat litter, I'm going to go out of my mind. But, you know.
But that's how you find out, Joe, about whether Medicare has paid or not. And a lot of people don't read those Medicare summary notices, even though over the last couple of years, Medicare has made them quite user-friendly. Years ago, it took somebody who really knew medical coding terminology. Today, they're quite user-friendly.
I agree. They
made
are
it much easier to read and to understand. And so I encourage people to look to make sure there aren't charges on there that you don't think are appropriate at all. A doctor you didn't see, or a test that you didn't get. That's fraud.
Thing I wanted to talk to you about on the show today, and I think I've made a horrible mistake because are you familiar with the mail order prescription service for the military?
No, not really. I mean, I know something.
You know what it is?
I know.
Well, I always, when I talk to Bill Johnson, or we have these shows where we talk about scams and fraud, I always tell people you get a call from somebody saying, I got a bill from this and that. Don't believe it, especially. But all of a sudden, it just, when talking to you, I got a phone call from the mail order script service, they called it. Mm-hmm. And that might be a copay I have to pay for a medicine for Lyrica that I get from Denver. It gets shipped to me because I can't get it in a local pharmacy. It comes to me from Denver, Colorado. So there's a copay evidently on that. I wasn't aware of it. So I've got a $50 or some bill, and it must be valid. So now I better call those people so that my prescription medication flow is not interrupted. This is the other part of the thing that we learn about that we do shows about ambulance services. We can do a show about SHINE. We do a show about medications. But we always find something, just like before you came out to the studio today. I had a fellow that sells, it's Joe Pons of Canadian Medications, mm-hmm. and I think it's a fair thing for people to know that Canadian Medications buys their medications from the manufacturers from sources outside the United States. It's interesting that the producers of the medicines are making a profit. Joe says, I'm making a profit, yet the people are still saving an enormous amount on their drugs. And here we are sitting here in the United States letting these companies do these kind of things, and we don't get control over it. And here we are undergoing a national election for the presidency of the United States, and we don't even know if these people that are doing these debates are telling the truth or not. It's amazing, Lance, the world we live in, and things. But what else? And I got off the subject when I got off the a question we had here is, what can I do if Medicare does not pay for the ambulance service? We're responsible, aren't we?
You may be, and I really need to say it in those terms. You may be responsible. The first thing to do is understand why the claim for ambulance services was rejected. It could be that incomplete information was not provided. It could be that Medicare really doesn't understand the medical necessity for the visit, and you may need to get some documentation or a letter from a doctor who may have treated you at the hospital, says, boy, I'm glad you got here by ambulance. And that sort of support for your appeal to Medicare might get the decision reversed. So you do have the right to appeal.
You have the right to appeal, but don't you believe in your heart that people that have these problems are people that may not have the education we have, that are sort of browbeat in the first place because they do things they're not sure about what they should do or shouldn't do? How in the world do those people know where to go to get help?
Well,
that's a problem.
Without making a full commercial out of this, Joe, the first call ought to be to SHINE.
Call SHINE.
Call SHINE.
No, it's a good question. It's a good statement.
Call us and speak to a counselor. We'll be happy to take a look at that Medicare summary notice, tell you what we think needs to be done, and can possibly help you to do it.
I apologize because I forgot about that. I forgot about SHINE is open 365 days a year.
All year. Just call us at 321-752-8080.
Say it again.
321-752-8080 in Brevard County.
Yeah. And folks, we're just about ready to close the show out, but I want to say that what Lance has said today about ambulance services and questions about medication costs and things like that, that's the purpose of a SHINE counselor. They help people understand what the real billing is and how you can save money. You do that with insurance? You do the same thing with medications?
Yes.
That's something I didn't know.
Yeah, we help people save money on medications by helping them to choose the Medicare Part D prescription drug plan that covers their medications at the lowest possible cost.
Thank you, Lance. And I want to thank you, viewer, for watching today's episode of Helping Seniors. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.